Hi, everybody. My name is Aitin Jagri. I am the Public Relations Director here at CyberPatient, and I'm also going to be your moderator for today's webinar session. Today's webinar session is the second session of a four-part series. It is called CyberPatient Design and Interface, Technical Requirements, Design Characteristics, and How to Operate CyberPatient. This is for medical students, faculty, and other health professionals. Like I mentioned, there is four sessions. The third session is going to be on Tuesday, June the 30th at 8 a.m. Pacific time, called CyberPatient Curriculum Integration as curriculum content and as an assessment tool. The fourth session will be on Thursday, July the 2nd at 8 a.m. Pacific time, called CyberPatient Research, Types of Research Activities, Completed Projects, Research in Progress, and Research Opportunities. Just to let you all know, in terms of some housekeeping things, all webinar recordings are going to be sent to you via email. There will be a link and a password for you to be able to gain access to the recording. We will also be having it up on our website. Secondly, in terms of asking questions, if you have any questions at all, there are two ways to ask questions. The more preferred method is to go to the Q&A section at the bottom of your screen and to type the question. Myself or Sam will be able to address that question for Dr. Karim. The second way is to raise your hand and you can verbally ask the question. Now, if there are any questions that you have beyond the webinar that you are not able to ask, or any kind of inquiries in any capacity, you can definitely email me. My email is itin@cyberpatient.ca, and I will be messaging that in the chat box as well. Other than that, what I'm going to do is I'm going to start this with a brief introduction on Dr. Karim Kayumi. Now, Dr. Karim Kayumi is a professor of surgery at the University of British Columbia and a founder at the UBC Center of Excellence for Stimulation, Education, and Innovation. He is also a past chair of the Technology-Enabled Learning for Vancouver Coastal Health and the regional director of the Royal College of Physicians and Surgeons of Canada. He is the founder and CEO of Can Health International, a registered Canadian nonprofit, as well as the CEO and founder of Interactive Health International, which is the company that created CyberPatient. He is also the inventor of CyberPatient product. And without further ado, I'm going to move this on to Dr. Karim so he can start with the presentation.
Dear colleagues and my dear friends, greeting and best wishes from Vancouver, Canada. We are going to continue our series of lectures on CyberPatient. And the previous lecture, we introduced CyberPatient to you and talked a little bit more in detail about the educational philosophy behind CyberPatient. So, So today we are going to be talking about CyberPatient design and infrastructure. So by the end of this session, you will understand the technological requirements for CyberPatient, the design characteristics of CyberPatient, and also you will be familiar with tips to how to operate CyberPatient. But before we're going to start about the technical requirements, I would like to take this opportunity again and express my appreciation and gratitude to all of you who have given us feedback for improvements of CyberPatient. Particularly, I would like to extend my appreciation to Dr. Sadaf Khan from Aga Khan University and his team for giving me outstanding feedback to improve CyberPatient. And today's lecture is also mostly based on frequently asked questions in tips. Perhaps you understand that CyberPatient is not a small app. It's a very heavy-duty online platform It has perhaps tens of thousands of pages of coding. It has thousands of pictures and x-rays and MRIs and movies and thousands and thousands of animations, tens of thousands of sound files. And it is very difficult for CyberPatient to operate when the environment, the technological environment, is not suitable. So therefore, it is very important that we should take into consideration all the tips that we are going to discuss today. So with respect to the technical requirements, perhaps the most frequently problems that people have had so far is they used web browsers other than Chrome or Firefox. And they use Internet Explorer, Safari, or others, maybe older even web browsers. And most of them will have problems with that. So therefore, I would like to stress the fact that CyberPatient is optimized for Chrome browser and Firefox browsers only. Please do not use any other browser. So the second important issue with respect to the technical requirement is hardware. As I mentioned before, it's a heavy-duty platform, and it requires a very good computer with a good RAM, random access memory, so that it can operate. It is all the computers are okay, and the laptops are okay with good RAMs, but it's also optimized a little bit for iPads, but it is not going to work with iPhones. Please do not use iPhones, because at this point, the technology of iPhone is not there to support this kind of heavy-duty platform. But we are working on it in the future. It will come perhaps soon. The third technical requirement I would like to mention is the accessories. If your computer doesn't have audio or visual equipment, if you don't have plugins for certain things, it's not going to work. So make sure that your computer has all the power to compute for CyberPatient, but also to have all the accessories such as audio and visuals, right? There are some technical challenges that we experienced during this time when we implemented CyberPatient. And I have to say this to you, is that CyberPatient is just 4 months old. It's like a newborn baby. It has a lot of, it may have lots of issues and with adaptation in different environments in different countries. And we are resolving those problems. And one of the major problems that we encounter is the country firewall. A lot of places, maybe some countries would have a very heavy-duty firewall that would not allow certain websites to get into the country. In particular, most of this is related to pictures and animations. And since CyberPatient is very heavy on pictures and animations, it would be blocked going into that country. So the country firewall is something that we cannot do anything about it. It's the decision, or political decision perhaps, or social decision of a country, and we are powerless to do anything about it. But there are also local firewalls. I have experienced once with my colleague in Calgary. She was asking me to give her guidance on how to use CyberPatient, and every place we went, it failed. So I was very frustrated, and then I realized that she was working from within a hospital, And hospitals, they do have, because they want to protect the patient's confidentiality, so they have a very heavy duty firewalls. So if you're within a hospital firewall or within a country firewall that is not liberated, you would have problems using it. That's why one of the solutions people found is to use VPNs, so that in most countries where the firewalls are difficult, they use VPNs. But what VPNs do is they increase they decrease the speed, increase the time of downloading the CyberPatient for practice. So that you have to take into consideration. We know that some places where they use VPN, it takes at least 3 minutes to download a CyberPatient to operate on. We are looking with our technology development group to find maybe some solutions for that. The other problem might be is the distance from the server. So our servers are at this point located in the United States of America, and sometime traveling over the oceans to other continents is time consuming for particularly in these days where due to coronavirus, everybody is using internet, and so the speed is a little bit lower. So to solve that problem, we are trying to make sure that in the near future we have specific servers in Asia and in Africa, so that that we would get rid of this distance problem that is created in the delivery of CyberPatient. So we did talk about the computing power a little bit, and there are also some serving problems. It is very important to mention at this point that any software that is used on the internet or for your computer, you have to go and be trained on it. Like you can use Microsoft Excel without being trained on it. You can't use any other programs without being trained on it. But CyberPatient is a very heavy-duty, interactive multimedia platform that would require a little bit of training. Also, I have to extend this idea to you that it is impossible at this time with the technology present today to make the virtual environment 100% like a real environment. We are trying to come close to that reality, but we are the first one who are trying to simulate the realism of clinical conditions and clinical situations into a virtual environment. So we may have some flaws, we may have some problems, but with your help, we can solve those problems slowly. But there are specific problems that are technological related, which means that technology is yet not there to solve those problems. So we found a way how to get around it, but for you to understand how to get around those problems, how we solve those problems, you have to go to tutorials. You have to use tutorials before you use CyberPatient. Our research has also shown in at Kazan University that 50% of the students who use CyberPatient, they use the tutorial first, and the other 50% did not use the tutorial, but they were both okay with it. It means to us that maybe 50% of the people have played enough computer games, and they are from the generation that they know how to do things. In the platform is, we try to make it as intuitive as possible. However, the other 50% requires to go. So I strongly would encourage anybody who is going to try CyberPatient platform, or if you're a professor, you're recommending CyberPatient to your students, to make sure that they go through the interactive, through the tutorials. I'm going to talk in the end a little bit more about this, like how we do that. Now we are going to talk a little bit about the design characteristics of CyberPatient. The first thing you have to remember that CyberPatient is not a game. It is not a game. So it is a very heavy duty, as we mentioned before, educational philosophy-based educational program, software, or platform, anything you call it. So please treat it as such. So CyberPatient is not an app. So it's not going to be on your mobile device at this point. It would take the mobile devices to get to the point to carry this kind of load and interactivity. CyberPatient is designed as an online electronic platform through web browsers, and we discussed this before. CyberPatient is also designed for self-directed learning at this point. It means that the students would be in control of their learning environment, and they're going to get the feedback from themselves. However, due to the request of many of you from different universities, from different parts of the world, we are going to make this a faculty-controlled education platform within the next 6 months. But it is at this point, it is not a faculty control. If the faculty members would like to have the feedback from the students can share their password with their professor, or they can take a screenshot of the results of the CyberPatient from the feedback pages and send that to their teachers for assessment and evaluation and support. And it's very important to mention, I said that last time again, to mention that CyberPatient is not designed to replace other methods. So it does not replace patient encounter, does not replace the standardized patient, does not replace physical simulation, but it is an online simulation for continuum of care to support as an additional method to support medical education. So in the design of CyberPatient, we have 4 levels. So level 1 is designed for clinical year 1, maybe we call it someplace in North America as pre-clerkship. And the learning objective is to, by the end of this level, you would be mastering the skills on history taking. So in level 2 is designed for clinical year 1 and 2, again, pre-clerkship in some universities in the year 1 and some universities year 2. And the learning objective there is that by the end of this level, you are going to be able to perform general physical examination. Level 3 is clinical year 3, which is about clerkships in North America. And in this level, the learning objective is to be able to make final diagnosis, recognize emergency conditions, do the management and diagnosis of the patient. So to have the whole continuum of care. And the level 4 is for internship, where we introduce the penalties after 3 mistakes. That computer would be shut off if the students are making 3 mistakes. And it's by design, because we think if you go through all these levels through medical school, at level 4, you should not be able to make more than 3 mistakes. If you do, you have to go back to your books and read and study. So at this point, I like to also come back to a frequently asked question. A lot of people called us and sent us messages that, oh, we cannot go further than level 1. But you know, the system by default, when you register, goes to level 1, but you have to go back and change it to level 2, 3, or 4, any level that is according to your status. The other design characteristics that we can mention is that CyberPatient is not designed for enhancement of theoretical knowledge. So please do not expect that CyberPatient will give you a lecture on what you do wrong or what you do, why you should do this and how you should do it. It is simulating a patient in a clinical environment and like a real life. And a real life, nobody, I mean, you can just go and read somewhere, but nobody in the midst of seeing a patient would expect their professors to give them lectures, although some people do. So, so you have to have your clinical knowledge, theoretical knowledge before you come to CyberPatient. And if you encounter difficulties, you go back to your books, back to your library to understand and come back and practice on CyberPatient. And a lot of people are saying, oh, why don't we have feedback right away? You don't have in real life feedback right away. And we're preparing you for real life. So there is no feedback during the case presentation. On the feedbacks is only after you finish, after you made all your decisions, and then we gave you a very good feedback so that you can use those mistakes you made during the case for next time and learn on your own mistakes. This is perhaps the most important psychological aspects of CyberPatient feedback. So to learn on your mistakes in a cyberspace, not in a real life. CyberPatient is also designed for three-mistake roles. As I mentioned, the three-mistake role in level 3 applies, but it does not reduce your, it would affect your score, but it would allow you to move forward. It would not cut you off. But in level 4, it would cut you off. Now we're going to talk about some tips to how to operate CyberPatient. For this section, I do not want to give you a demo because it would take time, it's technologically difficult, but if you, and you all perhaps have used CyberPatient, at least most of you have used CyberPatient, so you know how it works. And if not, then you can go to our website and just register and use CyberPatient. So we can, if you like us to make a demo seminar, you could send a request to ITIN and we will organize that for you as a separate issue. But at this point, what I like to do is to not go through the whole CyberPatient platform, but to stay only on issues that was reflected by the feedback of our learners. So if you can see here, from the registration to history taking, physical examination, management, vital signs, diet, input, output, drug therapy, hospital days, consultation, recommendation, and feedback, most of these are very intuitive and you don't need much tips to receive. But in some of them that I marked here, we will stay a little bit longer and talk only about those tips that would make you use CyberPatient easier. So the dashboard, once you register, the first thing you see is your dashboard. So you can go into this icon and change your level if you want. And then this is your home. And in your home, you would see your time, the time that takes for you to finish your last case, the knowledge level that you are, in the cost that you incurred during that. So you can also go into your other statistics here and see all your past cases that you did, and you can look at your improvement. But also you can see your improvement in a semester-long sessions. So you can see on on every of these indicators, which is time, knowledge, and cost. How did you improve and where you are now and where you were before? We also have here, I cannot see you, but if you click in you versus ideal, you can see your comparison of that in that particular case with the average of other people. So you would know where you're standing. So, and then you click here and you go into the CyberPatient. So the first picture you see is this, and you have a patient history. So the patient is there. You can talk to the patient in two ways. One is to ask questions by category here as it's viewed. So the categories could include patient information, chief complaint, history of present illness, past medical history, social history, and others that are not in this picture. So when you click on these, the color would change and you have a list of questions that related to this section. And you can ask all those questions and you would make your judgment. But in order to go to the next one, you have to click back on this to bring this list of categories. And then you go to the next category. We'll have, again, a set of questions. You ask many of those questions, and then you click back on chief complaint to bring you back this category, list of categories. I have to say that there are questions that are within each of these categories are related to the patient, or there are some questions that are not related to the patient. You have to make the judgment what are the important and right questions to ask. And in the end, you will have a feedback on the questions that you ask that were not supposed to be asking, the question that you asked that you were supposed to be asking, and the question that was the most important to ask. This is good for the beginners, for novices, year 1 and 2, so that you can learn the art of history taking. But when you are the year 3 and 4, you can use the search engine. Like you can click the search and you can put your whatever you like to see, and in that question would be coming and you ask that question. Now, there's one important tip here. This search engine is not optimized for the whole question. If you put your whole question, nothing would come up, because people may ask the same question 500 different ways. So it's impossible at this time to make that happen. So what we are trying to do is to sensitize this search engine to the keywords. So if you just put a keyword, the list of other things that are related to that keyword will come for you to choose. For example, you say how, all the hows will come, where, when, and those kind of things. Then you can, or say smoking, alcohol. So all the questions that has those words that will come up, and you would choose in one of them. This way, with the search engine, you can finish history taking very fast. And here's a button here. It's called a finished patient history. So this would turn green and be activated only when you go through all categories. If you're choosing to go by categories. If you choose to go by questions, after 1 question or 10 questions, this would turn green, and you can click that and you go to the next level, which is history taking, the next session. In this area, I like to also bring your attention to this small green icon there. This is the patient's chart. This is this patient's chart, and it's very, very important. I cannot make enough emphasis how important it is for you to document, because when you go to the hospital, documentation, the right documentation of patient's history, physical examination, daily management, everything, summary is very important. So documentation is an integral part of medicine, medical competencies, and it's enforced by Royal College and by others to make sure that students know how to document things. So please go there, click there. When you click there, what will happen is that you would have the chart of this patient. And this is now, for example, history section. So in the history section, so you can type in here, what is the chief complaint? And then you listen to all others and make 3 at least hypotheses on what it possibly can be. Here are some tips, very little tips to how to do this, this page. Then once you click, you go to physical examination section. The physical examination section also is very complex because technologically it is very difficult to do everything you can do with a patient in real life to transfer that kind of activity into a cyberspace. But we did the best we could. And the solution we came up with is that you have here, as you can see, all the vital signs and important information that you want to see, like breathing rate and pulse and blood pressure and temperature and weight and those kind of parameters. So those kind of parameters you can get right away. But you cannot use any tools for physical examination, whether it is your hand and whether it's equipment, is because you have to close up the patient in order to do that. So the tip is here. You have to take this icon that is in here. You take that icon and click on the patient, and then you see this picture change with small little pluses in different area. Those are the areas that you can close in. When you click on that head, then the head will come closer. Then these things would be highlighted. And then you can look at the nose, and you look at the throat and mouth. You can look at the air. You can look at the through the ophthalmoscope into the eye. You can also do the palpation, superficial, deep palpation, percussion, and auscultation as the most important methods of physical examination. Aside from bringing patient in, you're also able to turn patient around on different parts. So if you, for example, click this in here on the plus in here, then you bring the chest of the patient closer to you. You can do the percussion, auscultation, whatever you want of the heart, and then you can click in here to turn the patient and do the same thing for the lungs. So these are the most important part of the general physical examination. So we divided this physical examination into general physical examination and a special physical examination. So a special physical examination is the whole book of bits is in this illustrated in animated in the CyberPatient. But we would not give you all those unless you look for it. So in order to do that, again, so before we go to the special physical examination, again, I am bringing here the importance of the chart that you should see now, whether the color of the skin, eyes, mouth, it supports your hypothesis or reject your hypothesis, pulse, blood pressure, ECG, whatever you have, right? And with respect to the special physical examination, you can go again by categories in switching, going down from special test to abdominal to gastrointestinal, and then percussion of the intestinal. So you can go through that. And then things are gonna come in here, and in order to make it easier for you, when you get to the point, then you can see that those special tests are highlighted. And when you click on them, on this side would appear that a doctor is performing that test. So it only not giving you an indication that you do this test, will also teach you how to do that special test. Because in year 2, in year 3, even, it's very difficult to remember all the special tests, but it's important to, when you see them and you hear them and you touch them, then you would remember them forever. So again, don't forget to click the chart and find out in document things that you have gathered, all the information that you have gathered. Then it's very easy. It's provisional diagnosis. We put usually 4 diagnoses that 3 of those may be according to your hypothesis close to that the patient has, and 1 would be totally off. So your job is to choose those ones, including the pathology the patient has, in 2 others that are close to that pathology, and the one that is far from that pathology is not, do not touch that. And then you click submit, and you will go. If you make a mistake, I will say you made a mistake, please go back, and you can just go back and correct it. So the lab test is also very easy to do. So you can do the same thing. You can do a lab test by categories, like when you can do it by search. All the lab tests that you can do in a hospital or in a clinic, it's all in here. It's all, the whole laboratory results are here. But it would show the results of the patients if it's indicated. If it's not indicated, then it would not show it. Again, we colored the green, the ones that is indicated, so that when you click, you will have the results of the blood test, whatever other, urine test, any other laboratory test that you want. You also can go diagnostic imaging, interventions, and the diagnostic imaging. If you click in here, you go to category of ultrasound, MRI, CT scan, and others, X-rays and others. You can also, if you're advanced student, you can also go for search. If you can go in here and say, I want to do a CT scan, you click the search, and again, use keywords. And then you will have that results of that laboratory investigations there. For surgery, being a surgeon, it's very difficult to animate or to make a surgery, a realistic surgery in a virtual environment at this time. And the only way you can do that is to use haptic technology. First of all, haptic technology is not at the level right now to have it online. You have to have machine and equipment, and most people, they do not have the money or the time to do that. So, and they are very finicky. So I have done a lot of research on haptic technology, and it's not really optimized today for tactile feedback. But what we taught as a pedagogue is to look back into the history of medicine and see what people in the past taught what's important, and say, usually there's an Latin expression that says mente chirurga act quam manu armata, which means that the hands of a surgeon should act, the brain of a surgeon should act before his hands, which means that you have to know the steps of surgery, and you know what kind of equipment you should use to perform that. If you know that, then you are going to a surgery with the mental capacity. Although you don't do it by hands, but you improve your mental capacity for a surgical procedure. So in this case, we can do, we can watch a surgery like you're going into or year 1 or year 2 students, or you can perform surgery or participated in performing a surgical procedure, or, such as a clerkship or the internship. So here it is. So when you click that to perform surgery, you have a tray of instruments, whether laparoscopic or open surgery, and you have the site of surgery. So, which is abdomen at this point here. So in order to do surgery, you will say, okay, I'm cutting the skin. I need a scalpel. So if you collect the scalpel, then the scalpel will go and automatically make an incision. giving you that yes, you understand what you need and this is the steps. And then you say, I would like to now use cautery to go to the different lawyers and stop bleeding. And then you click cautery and it goes further doing surgery to perform the whole surgery. If you make mistakes, it would, in the third level, it will allow you to move forward. So this is the solution we come up with surgical performance. We have about 12 or 13 cases of surgery. The daily management is also a very big problem. At this point with basic CyberPatient, we don't have patients that are staying more than 3 days in the hospital. So it's okay, but it's cumbersome. It is very difficult to go through every day of looking at activity, at diet, at monitoring the patient, at respiratory monitoring, at output and input, and all those parameters. So therefore, we actually, based on the on your feedback, we modified this, and I will tell you later on about how we are going to do this in the near future. But at this point, you have to choose all the details of your management for the patient, which is extremely educational from my perspective, because when I was a student and I was going to the ward, I barely knew what nurses are doing, what doctors are doing. I was just walking around behind 5 other residents and chief residents and fellows. As a medical student, nobody pays attention on you. So here, you actually have the opportunity to practice all those things. The other important page that, based on your feedback, I would like to pay attention on is the medication. This is a very important feedback we got not only from Aga Khan University, but from many other colleagues and friends and partners around the world. That the idea is very simple. We programmed about 2,500 different drugs in this CyberPatient. So you can find any drug in that. Of course, you can. There is a search engine. You can search for it, and then you have to know the strength of the drug, you know, the frequency of rate and dosage, and how to do that. So we know all that. However, the feedback we got is that it is based on North American standard. In the world, the whole world is not based on North American standard, but it is, people have, in different countries, they use different drugs for different issues, maybe different techniques of using drugs and so on. So therefore, based on that feedback, we changed this. And I'm gonna, later on, I will let you know what kind of a design we're proposing to change this to accommodate this feedback. The next issue is the most important part. It was assessment and feedback. Our statistics shows that not a lot of students goes to their feedback. That's not, it's because they think, okay, the game is finished, we're gonna finish. The game is not finished unless you go to your feedback page. And the feedback page is designed that you can see their knowledge score, you can see your time score, and you can see your cost score. It's $50,000. Perhaps it was me who spent a lot of money on the patient. But and then here you have the categories in the CyberPatient as it was in the chart. You remember overview, history taking, the physical examination, investigation, diagnosis, management, and treatment. When you click in any of this, it will give you an overall things. But if you go into the overall scores, but if you go to history taking, for example, then or follow-up, or see in this case it's management. If you go into history management, then you have more precise on specific issues related to management, or specific issues related to history taking, or related to physical examination. And then here it says the detail. When you click in here, then you get the real detailed feedback, not what is your score, but what was your choice and what's the correct choice, whether it is history, physical examination, or choosing drugs and things like that. So this is perhaps the most important part. Now, I don't want to take much of your time because I would like to leave time for questions and answers. In summary, I can emphasize that web browsers, right hardware, right web browser, and right accessories are important to operate CyberPatient. And it's important to not consider CyberPatient as a game. Go to the end and look at the feedback. That's the most important. Change the default level to level 4 when you whatever level you need, to level 1, 2, 3, 4 level, whatever level you need. CyberPatient is not designed for enhancement of theoretical knowledge. It does not provide feedback during, do not expect that it will give you feedback during the presentation of the case. And CyberPatient provides a machine assessment feedback that is in the end. So the other tips for users would include, as I mentioned, for history taking, do the search engine for keywords, use the chart more often. For the physical examination, zoom in order to see patients and zoom out. For the lab test, also use keywords for management of drugs. I will talk about the categories later on about the solution, but at this point, just ignore it if it is not to the standard of your country. We're going to come close to that later on. And when you do the feedback, please go deep, as deep as possible to reach the real feedback. And I'm telling you now, in the end of this presentation, what action plan do we have on the basis of what your feedback that you've given to us? The first one is we are developing an interactive tutorial demo case. We're in the process of doing that. Perhaps by the end of the next week, we're gonna finish that, and you're gonna see that. So what it means is that instead of a movie showing you what to do, we're gonna have you're gonna be in the driver's seat and take a case of CyberPatient and go with that, performing the clinical duties. And when you have problems, then the tutorial will come and tell you what to do next, or what you haven't done, or what you have done that you did not get this result. So it's more like a gamified version. It's more interactive, and people like this very much. It's also very modern and very new. We're gonna have develop a landing page for support. For support of students and faculty. And this tutorial, interactive tutorial, will be on that landing page. In addition, all our lectures, the 4 lectures that we have, will be also on that landing page. Perhaps by the end of next week, you're gonna see that landing page as well. We are also, based on your feedback, going to upgrade CyberPatient to CyberPatient 2.1. And in this upgrades, we're going to include some interface changes to make it more friendly. We're going to have some content corrections that by mistake went there. So we will correct those things. There are not a lot of them, but some we do. And then the most important one in this version would be faculty dashboard for faculty control. What it means that in the near future, the faculty would be able to assign one case to many students, many cases to one student, or many cases to many students. And also, if he assign a case to a student, he would be directly monitoring the success or the failure of that students, the progress of that students, and can give summative or formative feedback for them. We will talk about that maybe in the next lecture. We also talk about the hospital days reconstruction. So as I mentioned to you, it's very cumbersome to go through the daily management in clicking and clicking and clicking a million times. So what we come up with solution is that we will have the vital signs of the patient in whatever was done in the past for him in the days that the patient stays in the hospital. So you can go and change specific parameters for specific dates. And if it doesn't need to change, you just don't have to do anything. Like for example, if you give antibiotics to a patient for 7 days, then you check the temperature and see if everything is okay, no complications, no reactions, then you don't actually do anything with medication up until 7 days, and so on and so forth. So we're in the process of doing that, and we're close to completion of that. And then the drug delivery reconstruction, what we're going to do is we're going to introduce a category of drugs, not just a specific drugs, but students will be able to choose a category of that. Within that category, they can choose whatever they want, or whatever their teachers are recommending, or their country is up to. And the system would not reduce their marks because of that. So the students can go to category of antibiotics instead of tetracycline. They can choose ampicillin, and it will be, if they choose the right dose and the right conditions, then it's fine. So we solve that problem that way. And the patient chart is also a very good part of this CyberPatient upgrade, because the chart is right now for practice. You can type in the chart, but it's saved in the back, but it's not illustrated in the feedback. And what we are trying to do now is to, when you have the feedback, you can also have your chart in the feedback pages, so that you can go and see what did you type, what did you record it, and how did you record it. So you can practice your, you can show it to your teacher, and the teacher can go and look at it and give you feedback on how to do it next time better. So at this point, I would like to cordially thank every one of you for your attention. And I'm ready now to speak to you and discuss with you about the questions that you posted. Aitan?
Sure, yes. So the first question we have here is from Susan Ahmed, and she's asking, the feedback is summative rather than formative post each case. What is the underlying reason for that?
I think it is also formative if you go to the details. So if you go to the details, as I mentioned, it is giving you what did you do, what did you choose, and what is what you're supposed to be choosing. So giving that kind of a feedback, I believe, is formative. But we are going to talk about summative and formative feedbacks next week, and in more details.
Okay, perfect. The next question we have is also by Susan Ahmed, and she's asking, is the performance graph per each case student finish or overall on all cases finished?
Sorry, what the overall?
Sure. Is the performance graph per each case student finish or overall on all cases finished?
No, it's per case. It's per case, but the term ones that they do for 3 months, it's for all their activities, for all the cases. If they do for the semester, that graph for the semester would support all activities. But the graph that is circled, it shows the number, it's for that case. And in the back, they can also go into the dashboard and reach all of those. And there is an overall performance for all cases.
Okay, and next question we have is by Lori Graham, and she's asking, are the lab values reported in SI units?
We used all North American standards. So I mean Canadian standards. Sorry, we use all Canadian standards. But it's very difficult to consider all other methods and units that other people are using in the world. But we can think about that. yeah, we can modify it for the country if we want.
Okay, next question we have is also by Lori Graham, and she's asking, does the platform provide instruction on procedures, i.e. such as punch biopsy, suturing, joint injection, and IUD insertion?
Yes, we have a special place for choosing a procedure. There's surgery and there's procedure. So when you choose a procedure, then it will give you all the we give you the procedures animation, how it is done, and then give you the results.
Okay.
Yeah,
Uh,
we just finished a case with spinal cord, tab. So yeah, you can. There's lots of other procedures you can do that. Yeah.
Okay, next question we have is by an anonymous attendee, and they're asking, for nursing students, it's challenging to select correct medication dosage in order to proceed further. This is because nurses do not have prescriptive authority, so they can correctly identify drug names, category, and routes. Can modifications be made to CyberPatient to address this dosage-related challenge?
Yes, it could be if we when we are planning to do a different to modify all cases to nursing needs, and that's not in our radar for this year, but for next year. But at this time, I believe what you can do is to just click 3 times and you just move forward. If you're in a level 3, you just pick whatever is, if you just want to know what drugs, and you just click the name of the drug. And if you're not precise to the dosages and things, you just click 3 times and you move forward. So things that you, as a nurse, do not need, may not even bother with it. Just click 3 times and you move forward.
Okay, and our last question is by Al Monzer, and he has a comment and a question. I think the success of CyberPatient is to train students very well and to make the tutorial mandatory to all students before starting CyberPatient. And my question is it available for staff of universities to design new scenarios or problems or something like this and to send this to you, because there are different diagnoses in different cultures?
Yes. Yeah, thank you very much for this question. I think this is a very important question, and we are aware of that. And the answer is yes. We would love to develop, to adapt CyberPatient to local pathologies and local culture. If there are local issues, cultural issues that you would like to bring up to our attention, we would do whatever we can to change that and upgrade it to cultural even sensitivity. But to local pathologies, for sure, we would love to hear from you about your local pathology so we can make CyberPatient to your needs. Having said that, we are planning in the near future, perhaps starting next year, because this year we are very busy with other things, automatization of CyberPatient creation. So what we are going to do is we're going to have the avatars that you can build yourself. And then you can, if you went to an emergency room or to the ward and you saw a very interesting case, let's say a local case or whatever, so then you can go to the CyberPatient platform and you can, so that CyberPatient would have the avatar that you make will have all the physiological parameters and all the physiological conditions in norms. So then you go and change the ones that you like that would reflect your pathology, and you save it, and it will be saved as a new CyberPatient. So soon, perhaps you would be able, within 1 year or 2, you're going to be able to actually make your own CyberPatient, whatever pathology you like and whatever conditions you like. So that is coming. But up until then, we would love to help you and build it for you, because it takes lots of manpower, time, money, and everything else to do that. But we're well prepared to support you on that.
Okay, we have a couple more questions now that just came in. One is by Omar Ladil Hamid. He's asking the categorization of the ILOs of CyberPatient levels 1, 2, 3, and 4 in some medical schools which adopt the SPICES educational strategies, SPICES. How can this issue be fixed for novice pre-clerkship students?
I think we are gonna discuss integration of CyberPatient into different type of curricula the next lecture. I think we can postpone this answer for the next lecture, because we will talk in detail about how we do that. What is that? Maybe then we can discuss it. And in this discussion, I'm not. Please do not expect me that would have all the answers. I would like to hear from you. It's a discussion. It's a discussion with my colleagues. That's what I perceive it. So in this discussion, we learn from each other. So this is a wonderful question, a very good question, but we're gonna address it if possible, if you don't mind, Dr. Omar. If you don't mind, we will discuss it in the next lecture discussion.
Okay, and we have the next question by Nosha Farim. And the question is, what is your idea about using this app in Asian countries like Afghanistan? It will be beneficial for us.
Yes, we are using this in Afghanistan heavily. I think we have contracts with Kabul Medical School and Katib University, University of Herat in Mazar Sharif, and we are trying to bring this also to Nangarhar and in Kandahar. Yeah, a lot of people are using CyberPatient Afghanistan. It's very useful for a lot of, particularly for developing nations, to be very useful, because the patient availability is everywhere a problem. So yes, we actually finished a research project with Kabul University and also with Katib University. Hopefully we're gonna finalize the data collection and data analysis very soon.
Okay, and that's all of our questions for today.
Well, thank you very much again for your presence. Next question, lecture would be on curriculum integration. That will be very important, particularly for faculties to attend. I'm looking forward to see you all then. Thank you.
Thank you. Bye now.